All right. So really excited to be at another quarterly call, but I'm also excited to be presenting at this one and showing off a lot of the work that Dr. Katie Harmon, Dr. Yudi Tang, and a lot of other people at UNC and HSRC have come together to produce. So we will start. We wanted to take really a high level look at the dashboard and try and pull out some of the main themes that we wanted to carry over into this meeting. And it's right there in that big bold header. It's public health and transportation safety. We really wanted to take a unified approach with both concepts in mind when we were developing the dashboard. And then we also wanted to bring it to the Vision Zero communities and bring it to this call and sort of use the health outcomes dashboard as an example of what successful collaboration between public health stakeholders and transportation safety stakeholders looks like. In doing so, we wanted to pull these high level themes that we thought were sort of represented within our work that really do apply to transportation safety overall. And so the first of which is what can holistic public health data do for you and your community? And the first is that we are able to, through holistic public health data, demonstrate the unique impact that motor vehicle crashes have with respect to different transportation modes on North Carolina roadways. Much of the health outcomes dashboard is really dedicated to being able to take a deeper look into different communities in North Carolina and figure out how pedestrians, bicyclists, and all modes of transportation sort of fare when it comes to motor vehicle crashes. The second of which is it allows for a broader approach for data representation. The big takeaway and a really important thing that we've sort of built the data linkage around within this dashboard is the fact that not everyone is represented within crash data. Not every person injured in a motor vehicle crash has a crash record. So, what our health outcomes dashboard does is it allows us to look at emergency department visits, it allows us to look at emergency services and their reports. That way, we can put together the larger picture and sort of account for those people who may have been missed within crash data. The next sort of facet that we wanted to look at was the safe system approach. We've had through our work a lot of time to be able to go look through different strategic highway safety plans. And one thing is very apparent, and that's that good data is the key to really embracing the safe system approach, and really valuable in informing and guiding communities as they work to align with the safe system approach. And like I said, this can happen at the community level with your individual work as Vision Zero communities, but it also applies to the larger, more statewide approach with GHSP and other statewide organizations that really look to improve traffic safety outcomes within the state of North Carolina. So that being said, we wanted to present to you the project objectives. We've done this a little bit in the past with our past updates, but really wanted to point out three different things that we wanted to accomplish with the health outcomes dashboard. The first of which is building capacity and demonstrating the value of linked and unlinked health outcomes data within the scope of transportation safety. We really wanted to show how this sort of data approach addresses gaps in what we know about people who are injured as a result of transportation related injuries. Next, we wanted to be able to provide integral public health data to support Vision Zero planning efforts. We wanted to figure out how we can see this linked data represented in action moving forward on behalf of the communities and really see how the health outcomes dashboard can contribute to the work that you all do on a daily basis. And lastly, we wanted to identify opportunities for future partnership to further adapt public health insights into transportation safety action, top to bottom, from the planning process to the implementation process. We really think that the partnership between public health actors and transportation safety actors can yield a lot of positive outcomes. So we wanted to take a second to outline the different data sources that are included within the health outcomes dashboard. On the right-hand side, you're going to see the introduction tab that we've added to the health outcomes dashboard. It breaks down what each type of data that we've linked is. So the EMS data, the NC Detect emergency department visit data, the police crash reports, and then through our analysis, we also utilize the fatality analysis reporting system. So really, all of these different data sources are broken down within the introduction tab, as well as giving sort of users a quick snapshot of what the data shows on like a sort of per day scope. So I will now move on to the health outcomes dashboard updates that we've done since we last talked to you in, I believe, August. We've adapted user feedback through our iterative approach to user feedback and user based recommendations. We've gone ahead and used it to inform updates related to the introductory content, that tab that I showed you on the last slide, where we were able to really simplify language and make it obtainable to those that are using it. I think that's a big a step that we've taken since we last showed off the dashboard, is really refining the tool so that it doesn't take an epidemiologist or someone that's really experienced with data to understand what's going on when they see the outcomes. We've updated dashboard visualizations. Across all of the visualizations, we've incorporated one form of update or another. We've gone ahead and, revamped some of the descriptive language that we use. So if there is a more technical term that you see, we hope that you'll be able to find those descriptive details and be able to, sort of learn as you use the tool. We've also added content, lots of content. We added that landing page that I showed you. We've added content related to micromobility. We've also added EMS data visualizations, and then we also have linked crash and EMS data visualizations. So there's a lot there, and it's hard to describe verbally, but when we do go to the dashboard and see it, I think it's a pretty good spread of information that can be used in the planning process. We've also created for the Vision Zero community specifically the Vision Zero County Profile tab. This breaks down all of the Vision Zero sort of participating counties within the state of North Carolina and provides a county level profile of motor vehicle traffic injuries. And our hope is that these can be used within, again, the Vision Zero planning process, but also as we look to ask questions about how different road users within our communities are impacted in motor vehicle crashes, and sort of help investigate those root causes, and align ourselves with that sort of system level of thinking and the safe system approach. It also contains information related to county fatality counts, injury severity, ED visit rates, crash demographics, and then annual crash trends. We wanted to go ahead and outline a few of the different uses of the health outcomes dashboard, and the first one's going to be the annual trends visualization. This allows us to take a look at different road user types and locations, county-based locations within the state of North Carolina, to sort of get a good picture at the sort of counts, the rates that are all associated with bicyclists, pedestrians, motorcyclists, people who are injured in a variety of different contexts. So that's one really cool thing about the select road user type filter, is that it allows you to go through bicyclists that are injured as a result of all causes, or you could look at bicyclists that are injured as a result of motor vehicle crashes. And you're able to apply that same sort of line of thinking through both motorcyclists, pedestrians, and then people in general. And then, as you see on the right-hand side, this is just what the snapshot looks like. There's a lot of lines. It's very confusing, and it's quite an abstract piece of art. But what that shows is all of the sort of location filters within the state of North Carolina being sort of checked and displayed within this visualization. Next up, we have another sort of use case. It's different. It's a monthly trend use case. The really strong characteristic with this visualization is that it's updated on a monthly basis. It includes location, but this time it's based on NCDOT region. And it allows for region-based comparisons for users. So you can select within the top portion one NC region, and then in the bottom portion, you can select another and get that comparison. Again, we wanted to, we found it really important to include the different types of road users and the different contexts in which those injuries for those road users come about. So, yeah, next up, we wanted to sort of do another high level highlight of what we hope that the dashboard is used for. The first of which is going to be plan development. The health outcomes dashboard can serve as a really valuable data tool for communities as they embark on the planning process. And it doesn't have to just be at the community level. As I said, there's a little bit of something for everyone within this dashboard, whether it's a statewide approach, a county approach, or a NCDOT region approach. The data really is helpful in the sense that it contains modes that aren't represented in crash data, as I mentioned before. So it allows us to fill that gap where crash data sort of falls off with data from NC Detect's emergency department visit data, as well as EMS data that we have access to. And then lastly, in that plan development, just holistic and linked data is preferred to traditional data for those reasons that there are gaps that exist, say when you're just looking at crash data for a specific area. Next up, for grant applications, we're really hoping that the health outcomes dashboard can be used as a tool that helps in the grant application process. We want it to be viewed as an innovative data approach that can be included within your grant applications to show that, there are efforts in North Carolina to go above and beyond with respect to the data that we're using in our day-to-day work as transportation safety professionals. Lastly, it's safe system approach alignment. We're hopeful that the health outcomes dashboard can be used to really embrace that sort of shared responsibility aspect of the safe system approach and show the role that, non-traditional transportation safety partners have with respect to improving transportation outcomes. And that's exactly why we look towards that emergency department data. We look towards that EMS data as well as the crash data to inform what we sort of know about transportation outcomes in the state of North Carolina. Next up, I want to welcome Dr. Yudi Tag to share her screen, and she is really the architect behind the Vision Zero County Profile tab on the Health Outcomes dashboard. So I would love for her to be able to give everyone sort of a run through or a walkthrough of what they see when they click on the Vision Zero County Profile tab.
Thanks, Central. Could you please open and close your screen sharing? I will make sure. Thank you. So can you all see my screen?
We can see Uni.
Oh, thank you. So as Central mentioned previously, that we have developed a targeted visualization for counties with Vision Zero communities. And at the top, you can move the navigation bar to the right and find the Vision Zero tab here. So our goal for this dashboard is just to highlight the local Vision Zero initiatives across North Carolina using the emergency department data. And however, due to the limitations in ED data quality, that's the most reliable way to present health outcomes is at the county level rather than the city level. So as you can see, this is a drop-down menu of the Vision Zero counties, and you can select the county you are interested in, as well as the road user types here. We believe this dashboard will be a valuable tool for Vision Zero communities, and you're welcome to take a screenshot for using presentations, reports, or community discussions. So as you can see, the first row of those KPI cards provide an overview of the key metrics of the selected Vision Zero county. So first one is the total vehicle traffic fatalities using the 2019 to 2023 FARS data set. And the second KPI card is the motor vehicle traffic ED visits rate compared to the state rate. And you can see the higher than the state rate will show as a red color, and lower than the state rate will show as the blue color. And the third KPI card is the percentage change in motor vehicle traffic ED visit rate from 2019 to 2023, and increasing showing as the red, decrease showing as the blue. And we also develop interactive icons that allow users to view data by different user types. When selecting the trend lines, demographic breakdowns, and injury severities, measured as a patient disposition, the ED data updates automatically to show who is the most impacted by motor vehicle crash ED visits. And it is really important to note that those KPI cards at the top remain fixed and do not change by the user type. For example, when we can look at the Gaston County and select the all people injured in motor vehicle crashes, the dashboard just highlights the several key summary indicators at the top that including 116 total fatalities from 2019 to 2023, and an emergency department visits rate of 1,296 per 100 million residents, 1 million residents, and which is higher than the state average, and a 19.5% decrease in ED visits in 2023 compared to 2019. And the trend chart is showing that the rates kind of like declined after 2019 and then kind of like really stabilized. However, it's remaining above 1,200 per 100,000 residents by 2023. And the data indicate that the young adults aged 20 to 44 years, as well as the females and Black individuals, residents are at elevated risk of ED visits from motor vehicle crashes. And you can see the most of these visits result in discharge, accounting for over 90%, suggesting a high volume of less severe injuries, but still kind of like showing a substantial burden on the healthcare system. So again, if you have any questions about the data, please be sure to check our technical notes, which at the bottom, at the end of the tabs, or just directly email us. So that's pretty much all our end. I will turn it over to Sandra again for any questions on the feedback related to the Aviation Zero profile. Thank you so much.
Awesome. Thank you, Yudi. Folks, give me 1 second while I get the slideshow back up and running. All right. So next steps for our project team. We're really looking to sort of really keep going on that iterative approach to feedback so that we can adapt the feedback that we get from the Vision Zero communities into the health outcomes dashboard as we look to continue to improve it. So we wanted to sort of come up with the following questions that we would like to maybe pose to the group or have the group think about, and they can respond in the chat or come off mute during the question period. But what data needs do you have with respect to the planning process? What data specific barriers have you and your community encountered? Are there any examples of data needs that you and your community are currently experiencing? And then lastly, what data points do you feel are missing or would be nice to have in your work as transportation safety professionals? Next up, we just have our list of disclosures. The project itself is being funded by the North Carolina Governor's Highway Safety Program. The disclosures relating to data from the NC Detect data attribution and disclaimer, as well as the Office of Emergency Services and their data attribution and disclaimer. If you all want to get in contact with the project team, we are more than happy to field questions or get you connected to the right people. You could reach out to Dr. Katie Harmon, Dr. Yudi Tang, or myself, And we are happy to help and answer any questions that you all may have. And if you do have any questions, feel free to come off mute and ask. Now's your time, or put in the chat, and we're happy to take it from
Hey, I had a
the top.
question.
Yep.
So I'm looking through this and I'm wondering, is patients with severe injuries, is that similar or is that the same definition as serious injury on crash reports? Or like what's the definition of severe?
Katie, do you?
Sure. We often look in terms of injury severity. It's based on the actual disposition in the emergency department. And so, I mean, I would say on some level, if you're going to be getting treatment in emergency department, that's somewhat of serious injury anyways. But specifically people who are admitted to the hospital, because hospital admission generally indicates a fairly severe injury that can't be treated for being discharged home, are also transferred to another facility because often those individuals are getting transferred from a community hospital to, say, like a level 1 or level 2 trauma center. And then obviously people who die in the emergency department, that's also another level of severity. So it's not the same definition. Because,
Okay.
yeah, because then crash data, that's the law enforcement officer basically looking at the individual and seeing how injured they think they are based on what they look like. But in the emergency department EMS data, it's more based on actual clinical factors.
Okay, that makes sense. Thank you.
Any other questions?
Um, doesn't look like we have any in the chat, but I do see that someone reached out regarding demographic breakdowns and said that it would be great to see rates normalized for population, and gave the example, is the injury rate particularly high among Black residents relative to their share of the population? If you wanted to comment on that and how it relates to our ongoing efforts.
Great. No, that's a great question, Sandra. Oh, and thank you ever put that in the chat. Yeah, we have our demographic information. It's shown in multiple ways in the dashboard, including normalized by population. And so I think the statistic you're looking at is shows that in terms of the burden of injury, it's higher among Black individuals in that specific location. And we do see that pretty commonly for unfortunately many of our outcomes in our dashboard. So we do clarify if you look at for individual visualizations on the axis, whether it's like counts, which would not be normalized, and ones that are population-based rates. One thing that our dashboard does not have at this time is are any rates that are utilize exposure-based metrics. It's all population. And please let me know if that if you have any other questions related to that, if that was unclear.
Well, that's great. Thanks.
Perfect. And then it looks like Dr. Ising, who's also on our project team, added in chat that or compare counties tab is normalized to the populations. So that is all great context. Just give one final. Are there any other questions? And then I think we're good to go to the quarterly call wrap up. Perfect. All right. Thank you all so much for your time and listening to our updates on the health outcomes dashboard.
Thank you.